for Fisher. Robin, do you want to come in and amongst the group? Naomi, I'm assuming you don't? Yep. Yep. Okay, great. Well, welcome everybody. Today is a terrific day for the Sunshine Coast University Hospital and in fact all Sunshine Coast locals. One of the hardest parts of anybody's life is to be told that you have a loved one, a son or a daughter or a mum or a dad who is very, very unwell, and that person is going to require a long period of treatment in hospital. I've been in that situation, my family has been there, as have many, many families throughout Australia. The feeling of anguish that you experience, you don't know what's going to happen. In some cases we're dealing with terminal illnesses, in other cases not so terminal but serious illnesses that require everybody in a family just to drop what you're doing and attend the hospital. And it is a very, very difficult time for people, both emotionally and financially. And we're at the just near the Sunshine Coast University Hospital here this morning, a $2 billion investment in the Sunshine Coast in their public health. And one of the glaring deficiencies that we have right now is affordable accommodation for families who are doing it tough, families who are at their most vulnerable because a loved one is in hospital. And sometimes that stay might last a couple of days, sometimes it might last weeks, and in some cases months. And nobody can afford to pay commercial rates for that sort of situation. So I'm very pleased that Wishlist approached me and identified a need that we have here on the Sunshine Coast for affordable accommodation for people who are being treated and their families in hospital here at SCU. So today I'm announcing a $12 million investment on behalf of the federal government into the construction of an 8-storey building here just across the road, literally from the Sunshine Coast University Hospital. Now this is a project that Wishlist have driven. Wishlist are looking to establish themselves on this block of land just to my left here. And this will see affordable accommodation for families to be able to visit and support those sick people. I want to acknowledge Naomi Dwyer, who's the Chief Executive of the Sunshine Coast Hospital Network. I've spoken with Naomi yesterday and again today, and she acknowledges that this is something that will be a terrific asset to the Sunshine Coast. And when you look at the catchment that SCU operates, the catchment goes from Caboolture all the way up to Gladstone and out as far as west as Toowoomba. We're talking about 1 million people that this hospital, this terrific hospital, services. And this is a great opportunity for those people who are at their most vulnerable, going to be able to support their loved ones. So this is a project that Wishlist will run in conjunction with other like-minded charities, like Ronald McDonald House charities. And I know that Wishlist are looking to involve council as well. The ground floor of this building will incorporate 1,000 square metres of community space, and so this will be a building that is for the entire community, not just Wishlist. So this is a good example of government teaming up with not-for-profits. We all know that not-for-profits are struggling for ongoing funding on a daily basis, and what this building will enable Wishlist to do is enter into partnerships with other health-related businesses, and it will generate ongoing income for Wishlist to enable them to continue the great research and the millions of dollars in research that they've been able to generate. This is a great example of government being able to team with local charities to arm them with the ability to be able to become self-sufficient, and that is a terrific outcome for the Sunshine Coast. Tony, would you like to say a few words?
My name is Tony Long, and I'm a director of Wishlist. Only recently appointed as the director of Wishlist, but I'm very pleased to be here today. I've been involved in trying to establish such a facility for almost a decade now, and my good friend over here, the chairman of Ronald McDonald House, South East Queensland Charities, will remember me coming and talking to the board of Ronald McDonald House approximately 6 years ago at the Martyrs premises. And at that stage, we were just trying to work out how to plan for this. But today is a much, much better thing than planning. This is actually an announcement that will give us confidence and certainty about developing something that will have enormous impact on the people of the Sunshine Coast and beyond at the region that this hospital's catchment services. I can also say that in this time when you're talking about elections and so on, it's important to understand that this conversation that I had with Andrew 3 or 4 weeks ago was somewhat timely, because this is not an election promise. This is about a 3-year plan that we can actually build something quite exciting. And I think Andrew's already outlined and given a very clear picture of what we're proposing to do. Wishlist has a significant impact on lives already on the coast, on this region. The hospitals at Gympie, Maleny, here and Nambour are all influenced by a lot of the things that Wishlist does. You see the staff here behind here, they are constantly involved in helping the community here on the coast. So we're very, very pleased to be here, very thankful of the local member, and we look forward to seeing you sometime in the next few years, breaking the dirt here. Thank you.
All right. Robin, did you want to just have a quick chat about the need from a personal experience of affordable accommodation here?
Absolutely. So we last year ended up in SCU through emergency in PICU and then the children's ward with my son after an accident. And in that time, probably the last thing you're thinking about is accommodation or somewhere to stay, and you need to be close by. You can't be far away. There's no chance to be going back home. So the fact that people are caring enough and working hard to provide somewhere that people can be and stay close to their families at that time when they really, really need it is just invaluable. I think the difference about having accommodation that's not actually part of the wards on the hospital means that actually families can be close by supporting. My personal experience is supporting the children, but that obviously goes for other families as well. But supporting their loved ones and being able to support the carers that are actually in the hospital with them, and I guess swapping in and out as people need some respite and somewhere to go to decompress and calm down and process what they're going through. That's going to be invaluable for people.
And what sort of, talk us through your experience, what was available to you at that time, or what did you have to resort to because of the lack of facilities?
So my son was in ICU initially, or PICU, and my husband and I were sleeping on a 2-seater couch for about an hour at a time, tag teaming it. What it would have meant to have accommodation would be that we could actually tag team off-site and get some proper rest, so that we could come back a bit renewed. Obviously we were quite short in our stay, which we were very lucky for, but there's a lot of families that are in for a much longer stay, and so for them, when you see the benefit over such a long period of time, that's amazing.
And talk us through what that was like for you. I mean, obviously it was a highly emotional time for you as well, and then to add all of the sleepless nights on top of that as well. What was that like for you?
It was really hard. So it was an emergency situation, as it often is for families. So we were completely unprepared to be away from home or to have our little ones, other little one needing care. I've got a great supportive family, but sometimes what you really need is to have your other parts of your close family nearby. For us, one of the most precious memories for me is when my daughter was able to come in to visit my son, and she wasn't able to stay with us, obviously. But when she could come in, and he was able to recognise her and communicate with her, because we didn't know whether he would for a while. So
And how long were you in hospital for?
we were only in 4 nights, so I can see the benefits over 4 nights, and then I can see that would be, you know, astronomically bigger if you were in for a long stay.
Where are you from?
Peachester, so it's a 45-minute drive to get to the hospital for us.
And can we get your first and last name?
Robin Kirkland,
And can you spell your surname for us?
Kirkland.
Thank you.
Thank you.
Does anybody have any other questions?
Yeah.
Would
if we
Tony
could-
be able to step in?
Yeah,
Step
sure.
in, is that
Tony?
okay?
Step into the bush.
Well, I just want to know a little bit more about the accommodation and you know where you're at with the planning and what you hope it could potentially be one day.
Yeah, so far we are at concept stage to actually articulate the concept, as in the collaborative approach that we've been trying to establish by involving other organisations as well as council. And there's a lot of work to be done now to actually identify everyone's needs, the space. Andrew's already talked about the community area. Well, there's a set requirement for that space. If you know anything about Ronald McDonald House, theirs is all about demand, so we've got to work out the demands for those spaces. But I can tell you that the Reed House at Nambour gives Wishlist a very clear example of how we develop the housing or the accommodation facility here for Wishlist. Ronald McDonald House has a model that's global, and there's no need for us to actually tell them how to do it, but we're very pleased to say they'll be collaborating with us to develop the accommodation required for the demand that this hospital and generally this location will deliver.
You've been given a $12 million grant. Do you have any idea how much a project like this will cost?
Well, I think you have to understand that this is over a 3-year program. We're already building the house that the coast built over here, just across the water. That's for now, and what we're planning is for the future. Future being only 3 or 4 years away, and that's essentially necessary because this place is growing as we speak. The patient numbers are increasing. There are services here that are going to evolve into not just the region of the Sunshine Coast, but the area or the catchment that Andrew was talking about, from Caboolture to Gladstone to Toowoomba, and within that area. So the premises is likely to be up to 8 stories, and we expect that that's going to cost around about 24 million. So we've got enough for the accommodation, we've got enough to actually start. As Ronald McDonald House has done in Brisbane, they actually built a big building, a taller building and more rooms, or more floors, sorry, and they didn't fit them out. So that could be an option that we look at. But let me tell you, we're out there. We're interested in talking to anyone, philanthropic or otherwise. We'll take more money. We'd like to build it sooner, but our plan is over the next 3 to 4 years.
Just on that point in relation to funding as well, Tony, this project is estimated at a cost of $24 million. So the federal government is putting up half of that money over a 3-year period. Now, I know that Wishlist will be having all the folks standing behind me out there trying to raise as much money as they can to meet that other half. But I also want to encourage the state government to pick up the phone and talk to Wishlist. And the state government should be chipping in a substantial sum of money, if not the other $12 million. This is a tremendous project that will only add great value to this $2 billion facility here. And so I'm calling upon Stephen Miles, the State Health Minister, to meet us halfway and fund the other 12. Now, this is not contingent upon them doing that. This is not an election promise. This is money that is rock solid, set aside in the budget, which will be announced on Tuesday. $12 million, win, lose or draw come May. And this is a tremendous outcome for Wishlist, and I just want to congratulate Tony for the way that he's gone about this on behalf of Wishlist. He identified a need and was like a terrier in not stopping and continuing to try and get that money. So well done, Tony.
Thank you.
Good on you.
Yeah.